The topic we'd like to persuade and inform our audience about is the U.S. needing to make mental health care more affordable and accessible to low-income individuals. We chose this topic because struggling with mental health is very common and happens to a lot of people, even people that we know, and we now have a clear understanding of why getting help can be so difficult for some, and we wanted to share how serious this topic is. To help this, it requires the U.S. to address insurance gaps, high treatment costs, and expand provider availability to make mental health care truly affordable and accessible to low-income individuals. Right now, nearly half of low-income adults in the United States who need mental health care receive none at all, not because they don't want help, but because they simply just can't afford it. Low-income individuals face significant challenges in accessing mental health care, creating a cycle in which those who need support the most are often the least able to receive it. High costs for therapy, medication, and psychiatric services put care out of reach for many families who are already struggling to meet basic needs. Families reported 3 major barriers. These include the lack of insurance coverage, poor access to services, and the unaffordable cost. Families made a clear distinction between insurance and accesses, and having one or both elements did not ensure care. Although Medicaid and health providers can be an option, many have long wait lists, as well as many low-cost clinics are understaffed, causing people to have to wait months to even be able to get the appointments they urgently need. Without having access to mental health care, symptoms go untreated and can worsen the outcomes. Low-income neighborhoods, rural areas, and underserviced communities often lack local clinics or providers altogether, forcing individuals to travel long distances. This is something that's not always possible for those without reliable transportation, flexible work schedules, or childcare. Insurance is another thing people turn to when needing help covering the cost of mental health care. Insurance coverage for mental health is limited and inconsistent, leaving low-income individuals without affordable treatment options. Living in a poor or low-income household has been linked to poor health and increased risk for mental health problems. Financial stress and even basic needs can largely increase anxiety and the lack of affordable care, leaving these conditions untreated. The stress of living in a low-income household can include paying bills, access to basic needs, and housing insecurities. This is highlighting how the system is failing to meet the need of low-income adults. When people cannot afford therapy, cannot find a provider who accepts their insurance, or cannot reach a clinic because none exists in their community, the message is clear. Our current system is not built to serve everyone. We feel there needs to be changes made in the healthcare system to ensure that mental health care is both accessible and fair for everyone. We want to recognize mental health as a fundamental part of overall health, not an optional service or a privilege reserved for those who can afford it. With that, there are meaningful changes that can be made. We can expand and enforce mental health coverage so families never have to choose between paying for therapy and paying for their basic necessities. Insurance companies and Medicaid need stronger reimbursement rates so more providers will accept patients who rely on it. We can invest in a stronger mental health workforce by training more counselors, social workers, and community-based professionals who truly understand the people that they are serving. Strengthening community clinics and federal qualified health centers will also help ensure that the cost is never a barrier to receiving care. We can continue expanding telehealth, which has opened doors for people with transportation challenges, childcare responsibilities, or work schedules that make in-person visits difficult, so they'll be able to do that all from home over their phone. And if we pursue these changes, we can build a future where mental health care is affordable and accessible to all.